Indeed, severe damage to water and sanitation system, it's a great concern, and it increases the risk of waterborne diseases and outbreaks of communicable diseases. We at the country level work jointly under the UN country team mechanism, because this disaster requires comprehensive response, including water provision, protection, sanitation, food and shelter. So we coordinate with various line ministries through the UN mechanism. It's also beyond Ministry of Health. And of course, under the circumstances to prevent this outbreak of diseases, first, it's a provision of safe water, because in some places, provision of tap water was interrupted. So there is a supply of water, drinkable water, as a first. And of course, we are dealing with the health authorities to establish and strengthen surveillance system, because it's not only waterborne diseases, but also it's a seasonal influenza and COVID. And displaced people in a crowded communal settings also more exposed to a risk of outbreaks.
Thank you very much. Sir, let's take on the next question from Ivana Bozovic, RTS Serbia. Please ask your question. I think you're still muted, Ivana. There we go. Nope, we can't hear you. Try? No, I'm afraid we can't. Maybe type your question in the chat, if that's okay. In the meantime, I might go to some other questions that we have received from the media while we wait for Ivana's question in the chat. And maybe I might go to both Dr. Berdiklievich and Dr. Salio on this, because we've been getting questions on what some of the expected demands are on the health services, at this time, at this unprecedented time. How does the health system need to respond to this crisis? Maybe over to you first, Dr. Berdiklievich.
Yes, thank you very much. I have to say that first focus was on the life-saving supplies, delivering trauma and surgical kits, coordination of emergency medical teams' arrival to the country. However, the acute phase of the disaster is almost over. And of course, we have other health issues becoming more obvious. It's interruption of routine health services. We need now to focus on trauma rehabilitation and also looking at the primary health care, because after visiting several provinces, we see that it's hospital infrastructure, but also primary health care level severely affected by this earthquake. So a growing problem also surveillance, as we already talked about it, and the possibility of outbreaks. So what we are currently doing jointly with the Ministry of Health, we're conducting rapid needs assessment in the most affected areas to form and identify response plan with the support of partners and donors. Also to mention that growing problem would be, and already we can see that it's a traumatized population. So the need for psychological and mental health services would be increased in this regard. So it's a preliminary period before the reconstruction starts to ensure uninterrupted health services provision and public health services.
Thank you. Thanks, Bater. Flavio, would you anything to add?
Yeah. I think it's a question of capability and scalability as since the beginning. So I think in the future, what we are expecting is what Dr. Bater already presented. Primary care services as entry points, as a way, obviously, to ensure that the services are provided, and then increase in the level of coordination in which, in the way we're going to match the gaps, identify with available resources and capability in the field.
Many thanks, Flavio. So we'll take Ivana Bozovic's question, and Ivana has asked, what impact do you expect on mental health, and in terms of what you have noticed, what you've observed, and how can WHO help? Regional Director, will go to you first.
Yes, as a principle, Ivana, mental health conditions increase in all emergencies for obvious reasons, direct or indirect impact. Unfortunately, the earthquake in our region in Turkey and Syria is not the only emergency. Obviously, it's the biggest natural disaster in the century, but we see in the other emergencies as well the need to scale up mental health services, which are to be part of any assistance provided. Then, Banu, let's give the floor to our colleagues what they are observing on the field.
So, Batar, maybe you'd like to come in on some of the mental health impacts, expected mental health impacts, not just now in the short term, but in the months and potentially years ahead.
Of course, as we going out of the acute phase, the need for the psychological and mental health support would be only growing, and this disaster would have long-lasting effect on the population. People only now start realizing what happened to them after this shock period. Before the earthquake, we had a strong collaboration in the area of mental health services with the Ministry of Health, with the Ministry of Family and Social Affairs. What we can do, and the negotiating currently with the authorities, it's a trainer of counselors so that they can organize these services and reach population in the affected areas, but also there are many people who were displaced to other areas of Turkey, and they would also need to be reached with that services.
Many thanks for that. There's a question now here from Tracy on death tolls. I think this might also need, well, it could be to Flavio or Batir, but when it comes to the numbers we receive, how are they calculated? Who is reporting the death toll?
I may be not aware of the details of the national, but there is a national coordination mechanism where all information is collected, and those figures are announced on a daily basis, and actually you can see them in live TV channels.
Many thanks. So the next question here from Megan Ford. I think, Flavio, I might come to you because I think there's an element here of EMTs, and hopefully you can also tell us a little bit more about the EMT deployments. But Megan is asking, are nurses part of the emergency response teams, and how have nurses been supporting the response efforts, if at all? And then maybe a little bit about the EMTs that you are coordinating on the ground. Thank you.
Thanks. I mean, first of all, nurses are very critical functions in all the team and hospital. For sure are integrated as part of the team together with specialized physicians and alliance and technical auxiliary medical staff. What we have seen today is obviously unprecedented as well movement of volunteers with the level of capacity to complement the facilities. Those facilities have been augmented, the capacity has been augmented through the deployment of emergency medical team. Priority has been given at those teams that have the capacity to provide emergency care services, including surgeries, in the way clearly to augment the capacity of the local services. Local services, that is quite obvious, they feel a significant level of distraction. We notice obviously the fatigue on the workers, and then clearly the need as well to care for their relatives and family. So it is that's the reason why actually we call for a team with the stronger capacities to be located in the strategic location to complement the capacities of the hospital. And now we say in the second phase, looking more to those teams that will have the capacity to increase the primary care services as well.
Many thanks, Flavio. We have another question here on, do you already have full access to victims or survivors in Syria? Regional Director, would you like to take a stab at that one?
Sure. I would like to acknowledge that this is a joint effort with my colleague, the Regional Director of the Eastern Mediterranean region, Dr. Ahmed Al-Mandari, and his team, and our teams are working very closely together. The WHO's cross-border operations into Northwest Syria is based out of the WHO office in Gaziantep and supports a population of over 4.6 million people. Since the earthquake, WHO has shipped over 250 metric tons of medicines and supplies, and these included 7 trucks containing 74 metric tons of WHO emergency trauma kits, essential medicines and supplies, including materials received on the first charter flight from Dubai that crossed into Northwest Syria on the 11th of February, which are sufficient to provide 3.2 million treatment courses. The UN resumed its cross-border operation on 9 February, following 3 days of temporary disruption due to the damaged roads. And the second aid convoy since the earthquakes hit crossed from Turkey to Northwest Syria on the 10th of February with 14 trucks, and further convoys are planned.
Many thanks for that. If there's no further questions online, I'll take maybe one more question that we received in advance. Flavio, I think I'll come to you for this one. And it's about, a week in now, we are still hearing, remarkable stories of people being pulled from the rubble. But how likely is it now for search and rescue operations to, be successful?
I mean, search and rescue operations are still ongoing in certain areas. Vital, obviously, to continue looking for a possible victim under the rubble, and as well as increasing those services in the area where search and rescue operations are ongoing. At the same time, it's after the initial week of operations, we have seen a significant amount as well of medical evacuations has been conducted in terms of severely injured that have been clearly taken out of the rubble and then have been transferred immediately to their referral facilities. I think that's a level of coordination. It's impressive, I would say.
Many thanks for that, Flavio. And on that note, if there's no further questions online, I'm going to wrap the press briefing for today. I'd like to just give the floor one final time to the Regional Director.
Thank you, Manu. And on the last question, I just want to reiterate that it is absolutely critical to ensure access to healthcare for all those who need it, regardless of where they may be. And regarding Northwest Syria, we hope to find a solution to ensure a constant flow of supplies together with other UN partners, other international partners, civil society, and be able to reach all those in need. As the concluding remarks for this press briefing, once again, I would like to express my sincere condolences to all the affected communities in Turkey, in Syria, and express appreciation to the Minister of Health, Dr. Fahrettin Koca, and his team for his leadership and coordination with WHO and the international community 24/7. Thank you for joining. I wish all of you a strong health.
Thank you very much, members of the press. If you have any follow-ups, please do email us at eupress@who.int. As always, stay healthy. Take care. Bye-bye.
Recording stopped.